This is the sling that you're going to be wearing after your total shoulder replacement, and you'll be wearing it all the time, day and night, except to take off for getting dressed and washing up and doing your exercises. For the first 2 to 4 days or so after your surgery, your nerve block will be in effect, and you'll have difficulty moving your lower arm, and your sensation in the arm will be decreased. So it might be helpful to have someone who can help you these first few days getting the sling on and off. Your sling has different straps. These 2 straps, this one goes for the elbow to prevent it from sliding forward in the sling. This one here comes in the thumb web space to help your thumb from sliding. And then there's 3 different buckles, these 2 here and this one down here. So to help get your sling off, what you would do is I would support underneath the arm so the arm just doesn't flop down when you let go of the straps and buckles. And what I'm going to do first is unhook the 2 forearm straps. So I'll unhook this one up here, and then I'll unhook the thumb strap. And then I will unbuckle these 2, all the while supporting her arm. And then I'm going to unbuckle the waist strap. And then before I let go, I'm just going to take her hand, support it, and slowly lower it down as the sling comes off. And then she just takes it off her other arm. To get the sling on, what you'll do is you'll take the operative arm and you're going to put it in the sling. And what you want to do first before you start strapping is to make sure the elbow is as far back in the sling as it will go. And hers is as far back as it will go. And I'm supporting underneath, you can see, so her arm doesn't flop. And then I will put this strap on so the elbow doesn't slide. And then we can put this one on as well. This strap will come across the body and it'll go over her right shoulder, and she can get it on like she gets on a backpack strap, either reaching behind her or reaching over her head. So I'm going to bring this around behind her, and this is one way you can get it on. Then these 2 buckles will hook here. So now I can let go because this is being supported, and then there is the strap that goes around her waist. So I will come around behind her and hook right there. This ball is used in case you want to use it to squeeze for strengthening and range of motion of your fingers. This can be removed if you don't want to use it. So when your sling is on, your arm should be resting comfortably in the sling. You shouldn't feel like you have to hike your shoulders in order to keep the arm supported in the sling. The sling should be kind of halfway between your stomach and your side, like this one is. And your forearm and elbow should be parallel to the floor, and your hand can be slightly elevated, but at least parallel. You want to make sure too that the sling, that your hand is at least halfway in the sling. If we had a smaller sling, her hand would probably be hanging out at the wrist, and eventually that would get uncomfortable. Shoulder would probably slide forward as well. Prior to your surgery, your shoulder sling will be fitted in pre-surgery services and then put on again after surgery. Sometimes after people get home, they find maybe the sling is a little bit uncomfortable and you may have to adjust it. Most of the time you don't need to adjust it. But if for some reason you need to, sometimes the thing people will typically do is we'll unhook this strap and we'll just loosen it up a little bit. And this Velcro. And it just lowers the arm. If she felt like the sling was perhaps making her hunch up or raise her arm, and her arm is still pretty parallel with the floor. Now I'm going to show you how to apply the ice wrap that you're going to be wearing for the first few days or more after surgery. These are the 2 spots where you're going to put the gel packs in, which will be changed every 4 hours. There are 2 straps. This one, the shorter one, goes around the upper arm, and this longer one goes around her body and attaches in the front of the sling. When you are sitting down, some people are able to just sit in the chair and just let this ice wrap rest on their arm and it doesn't fall off. But if you're having trouble, if you're walking around or if it keeps sliding, then you'll want to attach it with the straps. This strap will come underneath her upper arm, like that. So attach there and attach here. Then this one's the one that's going to ground her body. So I attach this in the back, and then it's going to come behind her and come under her arm, and then attach it here. And these can be adjusted for comfort, snugger or looser. You'll eventually be able to pretty much get the sling on and off yourself, and sometimes it helps to rest the sling on a table, a bed, or the countertop to help you to get it on and off. One thing that she's going to be careful about is, because you don't want to actively move your shoulder these first several weeks, she's not going to just move her left arm and put it in the sling herself. She has to use her non-operative right arm to help put the sling in, the arm in the sling. So she'll reach across. And she'll slide. Make sure her elbow is slid and pushed as far back in the sling as possible, and it is. And then when that's ready, then she'll be able to attach the elbow and the thumb straps. And her sling is at her side. Then she'll reach behind her to put her right arm through the strap like a backpack. Then she's going to hook the 2 buckles in front of her first. Once that's adjusted, she's going to reach behind her and get her waist strap and attach that.